Welcome to all our Support Fibromyalgia friends. I am Melissa Talwar. I'm the Executive Director of the Support Fibromyalgia Network. We are so thrilled to bring you this very special interview. Today's guest is Dr. Andrea Chadwick. She is recognized globally as a leader in the treatment of chronic pain and fibromyalgia. She has joined the Swing Care team as the medical director. Let's everyone rally and welcome Dr. Chadwick to the stage.
Hi,
Hi.
Brittany. Thank you so much for having me. I'm so excited to be here.
We're excited for this interview and also the tie-in of what we just posted with the news with Swing Care. So I'm glad we were able to set this up to answer some of the questions that the fibromyalgia patients have. We do have a lot of questions, so we're going to do our best to answer them, and we'll add some more information into the description of the video. And if there are additional questions, we can pass that along to the Swing Care team. But I want to get started with more of your background because a lot of us in the fibromyalgia community, I have to be honest, we get thrilled when we hear from caring doctors who are compassionate and then working to do the treatment of fibromyalgia. So can you share a little bit of your backstory in medicine and then what piqued your interest in fibromyalgia?
Absolutely. That's a really great question because I think a lot of us in the space that treat fibromyalgia was kind of a convoluted path to getting to this point. I did all of my schooling at the University of Kansas for my undergrad and med school, and then found my way out to Los Angeles, which definitely wasn't in Kansas anymore, out there for sure, but did my training in anesthesiology. So I know that sounds kind of strange. Like, why is a person who studied putting people to sleep for surgeries, how'd they end up with fibromyalgia? Well, I very much enjoyed my training in anesthesiology, but early on in my training, I did a rotation in our chronic pain clinic at UCLA. And during my time there, it was just everything I had been looking for that was missing in the operating room, which was, well, first of all, a conscious person to talk to. I know, silly, right? But what I really enjoyed was hearing people's stories and their journeys and what brought them in, and then being able to examine them and come up with a diagnosis and a treatment plan, and then be able to see them back and see what happened. Whereas with anesthesiology, I just had that intraoperative experience and oftentimes found myself wondering, like, what happened to so-and-so after that surgery? And I would look them up and see what would happen and realize pretty quickly after that rotation that chronic pain was for me. So I did my fellowship in chronic pain. I also did a research fellowship, which means I got a master's in clinical research during that time as well. Knowing that research was something that was really near and dear to my heart because I believe that medicine is a dynamic thing, like it's constantly living and breathing and growing. And I wanted to be a part of that space in terms of learning more about conditions and finding better ways to treat people. And so historically, chronic pain out of anesthesiology is a very interventionally based specialty. So we do a lot of injections for different types of chronic pain issues, mostly related to the spine, but sometimes in joints or along nerves. But I oftentimes would see coexisting fibromyalgia diagnoses in the patients that would come in, and just started learning more about it. And then as I progressed after my graduation from fellowship, I became my own attending and started seeing patients on my own, and found as a female physician in a very male-dominated space, only about 18% of pain doctors are female. So having that female sex, I felt like I did attract a larger predominance of female patients, and fibromyalgia just started becoming something I saw more and more in the clinic space. And what I really started to notice as I progressed in my career was how fibromyalgia patients didn't really have a medical home. A diabetic would see an endocrinologist, a person with, problems with their gallbladder would see a gastroenterologist, but fibromyalgia patients oftentimes historically were treated by rheumatologists when they felt it was potentially a true rheumatic disease. And we know that there is inflammation as a component, but it's not the kind of inflammation that rheumatologists treat. And so outside of that, there's primary care, but oftentimes they're too overwhelmed to be managing chronic pain. There's neurologists, but they really don't understand fibromyalgia. They're used to treating neurologic disorders like Parkinson's and migraine. And so it became a very kind of, I would say it was very like long organic path towards my practice becoming mostly fibromyalgia. But it became more and more evident that it felt like a calling to me to start really creating my own home within my practice for patients with fibromyalgia. I would say probably upwards of 90% of my practice is now fibromyalgia. And it's basically formed my whole platform for performing research as well. So all of my research I perform in my fibromyalgia and centralized pain exploration lab is surrounding concepts of fibromyalgia and centralized pain. And here I am.
That's such a wonderful journey. And I think I can say that a lot of us in the fibromyalgia community got excited because of this emphasis. And this is something you mentioned about finding a home on different levels. And what we're trying to build here at the network is this idea of community. Patients have a community that they can call a home. Providers have a community that they can call a home. And bringing that in, because we've noticed too on an advocacy level, they keep asking us which house at the NIH we fall into. And we're like, well, I don't think we belong anywhere. Where do we belong? So it's nice to know
the truth.
It's nice to know there's acceptance, and then hearing from you gives hope and inspires our fibromyalgia community to know that you've been working extensively with fibromyalgia patients and filling in those gaps of the, lack of female providers in pain medicine with pain management too. I didn't realize those percentages were also really low. We just heard from Dr. Pinkston, who mentioned that in rheumatology as well. So united together as a community, we're much more powerful. So that's fantastic. And thank you so much for sharing with us.
Oh, absolutely. It's, I feel like everyone has a story. My patients have a story and I have a story as well. And it's always, I think probably one of my favorite parts of my job is really getting to know everything about my patients and their journey, and really becoming part of their lives in a small way, or maybe a big way. I don't know.
Well, we need more attention with the clinical care to fibromyalgia. And as you said, we keep getting bounced around into who treats what, and it's hard to find a distinction there. So that's why when we find providers working diligently and tirelessly in the fibromyalgia community, I think all of us can say we appreciate you and you appreciate your work.
Absolutely. It's when I recently was introduced to Ginevra Liptan, who's ran the Frida Center, and it was like seeing another unicorn in real life, like being able to talk to someone within what I call the allopathic or Western medical community, and knowing that there's other people out there who are passionate for treating fibromyalgia patients as well. It's like we're very few of us, but it was nice and honestly inspiring to meet her and the work that she's done. It's really exhilarating to know that there's little pockets of us around the United States and abroad. We just need more of us.
Need more of you, and then highlight and support you. We don't want you to get burned out. We want you to be as supported as possible. And depending on how many numbers is accurate for the fibromyalgia community in the United States, it could be from 4 million to 12 million. But you have millions of patients that can rally around and support the work and get things done. So from advocacy to pushing for research to better clinical care, we're with you. And I'm so glad you got to meet Dr. Lipton. We're big supporters of her work. I've been to the Frida Center frequently, and we give out her book quite often as the starting guide for our new patients. Like, here's what you have, your guidebook. So we appreciate all of you. I can't say that enough.
That means a lot. Thank you so much.
Well, and now the biggest news of all, the news is buzzing around social media with we shared with Swing Care. And you've gotten involved with all the wonderful people at Swing. You guys are all amazing over there. One day I'll have to somehow give you guys hugs, high fives, whatever people appreciate. Since we've all been
hug. I'm a hugger.
So can you tell our friends a little bit more about this groundbreaking virtual clinic?
Absolutely. So, as I said, fibromyalgia really lacks a home within a specialty, but generally speaking, in most medical communities, Most regional areas don't have a provider with that expertise in fibromyalgia. And interestingly, when you look at what fibromyalgia is, that concept of centralized pain and central sensitization, and how it really is just kind of an overlapping, or not overlapping, but overarching central nervous system functioning, really, in my opinion, any medical provider can see and treat these people, people with fibromyalgia. It's just hard to find that specific person for that area. So once I started seeing fibromyalgia patients, I started getting referrals from across Kansas, Missouri, people from Nebraska, Iowa, Oklahoma, just that regional interest. And with the laws on telemedicine and practicing medicine with licensure, I knew I could only do so much within the state of Kansas. I'm also licensed in Missouri. But outside of that, the growth really then becomes, how do we find and train clinicians who are experts in their own right, whether it's internal medicine, family medicine, neurology, rheumatology, pain medicine. All of us have the ability to understand the mechanisms underlying fibromyalgia, and then understand the research, the body of evidence that's out there to treat it. And it's really not rocket science. You know what I mean? Like, this is just hands down understanding pathophysiology, which is what causes fibromyalgia, and knowing how to treat it with a variety of different non-pharmacologic, physical, behavioral, and then pharmaceutical methods. So when I was approached by the good folks at Swing Therapeutics about this potential opportunity to start a clinic, I was like, yes, this is so sorely needed, again, because that home doesn't exist. And while there are pockets of us like Dr. Lipton and myself and Dr. Claw at the University of Michigan, there's only so many people we can reach. And therefore, I believe, and my mentor, Dan Claw, and many other people believe, this is something we can teach other people how to do. And so Swing Care was born out of the idea that a telemedicine space is a perfect place to deliver fibromyalgia care. And we can take physicians who have seen fibromyalgia patients previously, but give them great education, great training from the experts who know all how to treat this, and have them care for fibromyalgia patients on a larger scale. So it's really exciting. It's all informed by evidence and what's good for fibromyalgia, recognizing that what's good for one person with fibromyalgia may not be good for another person with fibromyalgia. So we're really paying attention to that personalized care, focusing on the one person in front of us, hearing their story, hearing their journey, and coming up with that personalized plan. It's so exciting. I haven't felt this excited and passionate about a project in a really long time. And I can't wait to see the growth of this, because as you said, this is a national, global problem. You know, I've had some opportunities to work with Fibro Ireland and the advocacy they do over there. I mean, this is a problem everywhere. So I really view this as just the jumping off point for how we can transform fibromyalgia care for not only the patients that exist here in America, but beyond.
I'm so energized to hear this because I can feel your excitement. I'm getting even more excited because of all the possibilities. Like, I do believe that we can do this, coming together with the providers, like you mentioned, even with Daniel Claw, understanding these research components and how we can support this along the way. As a health coach, I got excited these past 2 years doing group medical visits. So I'm like, whoa, what are these possibilities to help with behavior change and being involved with a provider that can help with medication management, make sure the blood tests are run and on track, but then you work on lifestyle changes with a health coach in a group setting. So I know the possibilities, and working and teaming up together, it's endless. I know we haven't exactly figured it out completely, but just letting our friends, our fibromyalgia friends out there know that this process is starting. Please don't give up hope. I mean, this is what's going on in the background that you may not see. And that's what's so energizing for a lot of us as patient advocates and patient leaders. And you were kind of mentioning too some of the advances, some of the gaps. What else are you noticing within research for advancing fibromyalgia or even clinical care?
Well, interestingly, we know that there's only 3 FDA approved drugs, right? You've got your pregabalin, you've got your duloxetine, you've got your milnacipran. That is all the providers of America have that is FDA approved to treat the symptoms with fibromyalgia. So looking beyond that, I think there's a lot of novel drug development coming up, looking at different targets along those pathways within the central nervous system that can modulate either inflammatory or sensitization changes. I'm a big proponent of low-dose naltrexone. It's a drug that I use quite frequently in my practice because it truly treats an underlying mechanistic issue that many patients with fibromyalgia have going on. And so I know there's a lot in the area of drug development with novel targets that are going on. And I think we should start seeing some of those come through the pipeline. But more interestingly, I think when you look at the current medications that we have, while they may manage symptoms, they don't take care of all the problems that afflict the patients with fibromyalgia. I mean, as you know, there's a lot of other issues that go beyond just the painful symptoms. And that can include difficulty with exercise and activity. It can come to making decisions about how you may pursue activities outside of exercise and your typical physical things, just simply even maybe being able to attend sporting events or go to social activities. So when you look at the space of fibromyalgia care, it's becoming more holistic, in my opinion, recognizing that drugs can only get us part of the way, and they are very useful for symptom management. But outside of symptom management, I believe it's about living your life. And so the types of treatments that can help, transform that landscape for fibromyalgia patients are things like cognitive behavioral therapy, acceptance and commitment therapy, and oftentimes accessing those types of specific therapies with a pain psychologist. Again, just as with a fibromyalgia doctor, we're hard to find pain psychologists with real strong expertise in delivering those methods of interventions are also lacking for the general public within the United States. So excitingly, there's all sorts of novel digital therapeutics that are being developed to try and bring those types of treatment therapies into the hands, literally hands of patients with fibromyalgia, so that they can access these not only, on their smartphone, but also on their own time, which we know for patients with fibromyalgia, they're doing their best to try and manage their life, whether it's family, work, friends, medical appointments. So being able to access care in platforms and in ways that make it easier for someone to access on their own terms, I think is really important.
Definitely, and I appreciate all this information, and I hope all our support fibro friends are taking it in, because these are how we're building up a whole advancing of the fibromyalgia community and bring it together. And it just resonates with our community because I talk about democratizing the knowledge of what we're trying to do with the Project Echo launch of training medical education, training providers, but also then tying that into our support group leaders so they can better support our mental health professionals coming in to more support, and then of course our advocates. So this helps us lead, because right now we're strategizing for 2023, and we've taken over 100 meetings with our representatives in Congress.
Fantastic. I mean, you got to start at that grassroots level. You really do, because it's really interesting you bring that up. I've had the opportunity to even speak with some of our representatives here in the state of Kansas, and they don't recognize what a huge problem and impact fibromyalgia has on the communities and their constituents. So you really have to get that knowledge out there. And I mean, knowledge is power. So if you can bring it to the people who can make decisions that impact your life in a very meaningful way, you have to do it.
Well, and then connecting the dots. So if we can
Yes.
try to push for that added funding or the reclassification so it opens up funding, then we have people like yourself and other researchers that can take that and get stuff or at least apply and get funded. But it's directed towards translational treatment that we all know that the fibromyalgia community needs and the things that you've mentioned as well. And especially when you tied in, you said digital therapeutics. And I know last time when we had some of the swing team come on and join us for the interview, Jeremy talked about digital therapeutics. And I know this is a big part of the swing care plan. Do you mind sharing briefly a little bit more about Stanza and how this kind of goes beyond telemedicine?
Absolutely. And again, one of the things I always tell my patients is, your fibromyalgia care doesn't exist in a silo, and that silo is not my clinic office, right? Or my computer screen if I'm seeing them through my telemedicine clinic. You patients with fibromyalgia, I can't be there all day, every day to be helping you through your life. And so one of the beautiful things about care in novel and innovative ways is it really allows for the care to continue between visits. And so digital therapeutics are really kind of a new space. I'll be honest, when I started working alongside Swing Therapeutics, learning more about digital therapeutics, I had no idea this was like a thing. And then I learned more and more about it. And I'm like, this is magical because it really does bridge the patient from clinician visit to clinician visit or with their other providers. And it's, if you ask me, it's like kind of a home within a phone for them to be able to access tips and techniques and actual delivered behavioral medicine techniques to help improve their symptoms and quality of life with fibromyalgia. And something I really have enjoyed learning about the digital therapeutic Stanza is how it's really based on science. I mean, real deal, actual science that shows that these types of behavioral interventions can lead to changes within people's pain processing regions of their brain. But more importantly, it allows them to learn about what their values are in life and how pain affects those. And how do we marry those two things? How do we work through some of the pain issues to be able to have our values met? Because as a human, having our values and needs met is how we live and live well. So Stanza's there to be able to help people live their best lives. And we're very much looking forward to it being one of the offerings in our telemedicine practice at Swing Care, knowing that it may not be the right fit for everybody, but the fact that it's there is a beautiful thing.
Well, and it's multiple modalities. That's what we want to remind the fibromyalgia community about. So like you mentioned, with maybe moving away from monotherapy type thinking, but adding different layers of modalities that can help. And I love digital because, as you mentioned, it's on a smartphone or new computer type systems, can do it at home. And we don't have to, I mean, we can just do it in the comfort of our home in our own time, which makes such a difference because sometimes when we talk about fibromyalgia research that's helpful and when it translates into real life of a community, it tends to require going somewhere or finding the place. Even stuff like where we talk about things like Pilates. When I drove around the country, I actually tried to pay attention to how many Pilates studios were available to people in certain areas and even in major cities that wasn't as available to get to the cost. So how can we bridge these gaps and make it attainable and accessible for a wide variety of people, no matter where you live in this country? And that's why digital is so great and fascinating and when it works. And how can we benefit from that even more?
Absolutely. And to your point of the monotherapy, I have never been a believer in that. And in reading all of the literature, it really is a parallel approach, a multi-pronged approach for managing symptoms, but also these behavioral techniques, the physical modalities are so important, that body work. And, oftentimes I'm sure the patients in the support network have heard, oh, well, you just need to exercise, right? Like that's kind of just like the line that doctors love to give anybody, right? But especially fibromyalgia patients. And I think part of that is because there's just a misunderstanding in a lot of providers' minds about how this is best treated. They may not be up to date on the literature, but really the focus should be on movement, whatever that may look like. And I tell my patients, it may look like floating in a tub. It may look like walking in water because that feels better on the body. It may be walking. It could be doing Pilates. There's all different types of movement. And I think this focus on exercise instead of movement or activity is rather marginalizing and disenfranchising to a lot of fibromyalgia patients, because if the pain is quite severe and there's been a lot of fear of movement throughout one's life with fibromyalgia, you can't expect someone to go ride a bike for 60 minutes. That's bonkers, right? Like, I don't think I would recommend that to someone who hasn't moved much for a while. So the fact that there's this concept, and one of the focuses in Stanza is that concept of movement and pacing and leading up to some sort of activity or exercise regimen. But knowing that that looks different for everyone, and that the focus of activity and movement should be about what makes you feel good, because exercise and movement is supposed to make you feel good. And that looks different for everybody.
Absolutely. I know I'm one of those patients that tends to flinch when someone says the word exercise. And what we emphasize too is movement and things that bring you joy and play. Like you can play and move your body with your dog, with your grandkids. You can dance. One thing I share with everybody out there that knows, after long meetings, I have a playlist. So I'll hit that playlist and I'll just move after I've been sitting for a long time with music. Or you throw on music to do your chores and just have fun, things that bring you joy, and how to incorporate it into your life. But you can do that at home. That's the great thing. You can go outside and walk outside in your yard or anything like that. So that's something that we have to remember.
Well, and it's interesting you bring up music, because there's a lot of emerging evidence. In fact, I just published a paper looking at the analgesic benefit of music listening. So music and art are forms of therapy and can be useful in that multimodal treatment of fibromyalgia. So all of these concepts and ideas are not crazy, right? Like, it's not crazy to think that like art or music or movement is like this crazy, like huge thing that we've discovered. Like, it's been around for a super long period of time. But I think so often, especially in Western medicine, the focus is on, what can we do with the procedure, or what can we do with the medicine to try and make people better? But it's really this idea of a fully integrated and multidisciplinary approach that, at least within my own practice, and again, I kind of built it by myself. I didn't really have like outside of Dr. Claw with my research and with being able to read things, I didn't have anyone else in the space to teach me how to do this. So it's kind of just grown and become this very positive space. And I focus mainly on wellness, and that's translated into how I'm teaching and educating the clinicians of swing care to be able to kind of replicate that kind of care, because fibromyalgia patients deserve it, and we know it works.
I love this. And I know from the Swing Therapeutics team, everyone is genuine and they care about the fibromyalgia community. And that's why we wanted to showcase all the work that's being done and make sure that you get well connected to everybody in the fibromyalgia community, because it's so important with wellness. And one of the underlying concepts of all of this is we're putting patients back into the driver's seat. Because I know how disenfranchising it can be. You're running around from specialist to specialist. You feel defeated in the system, the medical system, trying to contact insurances and all this other stuff. But with this, and what we're talking about is, again, patients are actually driving the ship. Like, they're in charge. We're helping support them along the way with a different perspective, which is really incredible and something unique when we can talk about and share with the community.
I love it. And what the work you're doing is fantastic. I really love this idea of health coaching, because, there's only so much an education I can provide as a clinician. To have coaching and have that support network to help you through something that might be difficult or scary, or maybe you've never done it before. I mean, it can be very overwhelming. So kudos to you and the work that you do with your community to empower patients and be in that driver's seat. And it's something I tell my patients all the time, is the expert in the room is the patient. They're the ones with the lived experience that I can't say what that is. I don't have it. So listening to the patient, knowing they're the expert in their own condition, marry that with the knowledge I have from the medical and research and even complementary alternative space. It's a really delightful thing when people can work together for shared medical decision making. And that's something that, again, Swing Care is wanting to approach our telemedicine practice with, that idea that this is shared. This is a shared medical decision. Obviously, the doctor and the clinicians have medical knowledge about what medications might be right for what that person is taking, but there should be a discussion of, hey, what do you think about this? Does this sound like a good plan for you? That's pretty much how I've run my practice, and it's how I want Swing Care to operate as well.
I have a big, huge smile on my face right now. I'm thrilled to know that this is happening and in the works. Now, with Swing Care and the launch, I know that there were some particular questions people had with timing. So just with the questions itself, so launching in the USA first, right?
Yes.
Okay. And then the process to get contacted, they can sign up to get waitlisted. And then what happens then?
So as of right now, the waitlist is actually lifted. So if you meet criteria for, I think it's about 3 questions, you can schedule your appointment. So the waitlist was just while we waited for getting everything ready for launch. And as of right now, you can log on to the website, do the entry questions. And if you meet the criteria, which really as of right now is the diagnosis of fibromyalgia, living in Texas, and having a primary care provider. Those are our 3 things that will allow you to schedule an appointment.
Oh, fantastic. Okay, so Texas is the big launching point. So for fibromyalgia patients, if you've been diagnosed with fibromyalgia and you live in the state of Texas, you're opening up, but people can still sign up in case you open up in other states?
Yes, so we do have a link at the top of the website that is for people to be able to say that they're interested and where we should expand next, which I think we're very much hoping that this will eventually become a nationwide service.
Well, we hope so too. I mean, is there anything that we can do as a community to support that expansion?
Well, obviously getting the word out there so that patients can enter the clinic and get it running is super important, because without patients, we can't do anything. And that growth is really predicated on people signing up for the service. So we are really excited to start offering care to the patients of Texas, and we look forward to getting started.
Well, I'm looking forward to being involved and hearing more about the progress, because it's definitely exciting to see the plans, the treatments. I know a lot of people have questions, so we'll definitely continue to post links on the frequently asked questions and share more. I mean, we're going to have a lot more information after the fibromyalgia conference coming up too. So thank you so much for your time today, Dr. Chadwick. We really appreciate it, and I am so energized right now.
Absolutely. Anytime. I'd love to be back and answer more questions from the community. And honestly, I'd love to learn more about your health coaching, so I can maybe link that in with the work we're doing at Swing Care and even beyond.
Oh, well, my brain has the hamster wheel going right now. And I had a chance to go and speak at a group medical visits conference with other providers, making it happen in both in person and virtual care. So we'll have a great conversations ahead. And thank you to everyone at Swing Therapeutics for all the amazing work that you've put in. I feel like I'm on repeat, but we appreciate people that want to invest in the fibromyalgia community. So we're so thankful. I owe all of you something. And I know all our Support Fibro friends, our team owe you. I know Brandy loved the approach. So we're here rallying all behind you.
Thank you so much. It's a pleasure. And I look forward to more conversations.
Thank you to all our Support Fibro friends. I hope you've enjoyed this fantastic interview and are just as energized as I am. Please reach out, post your questions, get involved, sign up, let your friends know if they live in Texas that they got to check this out. So swing.care is the URL, and we will talk to you later, everyone. Thank you so much. Bye.
Thanks for having me.